Hey everyone, today we're going to talk about the 3 different types of HIV medications, and I'm going to link some videos below where I kind of maybe go into some of these more in depth. And it is important that we understand that there are 3 different, not just brands of medication for HIV, but 3 different uses for them, and they're all different, and it's important that you understand them. So first one is, if you have been diagnosed with HIV, there are treatment medications. That's the first type of treatment medications for HIV. So the thing that is important to understand here, and most folks now understand this, but I'm old now, so when I grew up, the notion of an HIV diagnosis was considered that you were going to have a very, very impending death. But now there are such good medications that most people, if they can afford access to them because they can be expensive, can have an almost identical life expectancy and can have a very long and healthy life with HIV as long as they are keeping up with appropriate treatment. The treatments have gotten better. That is the first type of HIV medication. The second one, and this is one that I think is really important and probably the least known of them, that is HIV PEP. Post-exposure prophylaxis. When I'm talking to patients at the urgent care, I usually talk to them and I say, hey, this is what I call the something just happened and I'm nervous medicine, okay? And that can be any event of concern. That can be a sexual encounter, that can be a needle stick, that could be any event where you're saying, hey, something just happened to me and I think I might have been just exposed to HIV. I'm nervous about that. If you start this medication within 72 hours, HIV PEP, post-exposure prophylaxis, your odds of catching HIV drops significantly. So go ahead and watch that video, learn a little bit more. If you have an event of concern, get a hold of your local emergency, your primary care doctor, your urgent care, get a hold of someone immediately within 72 hours, and you might be able to start this medication that can dramatically reduce the odds of HIV. The next one, and I think this is one that a lot more people are familiar with existing, but I think a lot of people might be appropriate for this who don't necessarily think that they are, because a lot of folks just assume this is for other people. But if you have a slightly higher risk than average of being exposed to HIV for whatever reason, it is important to consider that HIV PrEP might be right for you. That's pre-exposure prophylaxis. When I'm talking to patients, I use this and I describe it. This is a, hey, something might happen to me. I'd like to prevent it. I'm willing to take a daily medication to dramatically reduce my risk of HIV infections. Now, reducing the amount of partners, avoiding needle sharing, using barrier protection, those are all great methods, but another tool in the toolbox is HIV PrEP. So please make sure you talk to your doctor about that, talk to your local health department, your infectious disease department at your local hospital. There are lots of folks who can help you decide if PrEP is right for you. So those are the 3 types of medications. It's not just treatment for HIV. It's something just happened and I'd like to cut down the chance of exposure from that one particular thing turning into a transmission. And there's also PrEP, just a literal ahead of time preventative daily medication to help avoid HIV. If any of those are right for you, please, please, please talk to your doctor and make sure you get on the right stuff. Thanks.